If you are in a situation, this is 100% agree with practitioner Andrea. I just want to say that first, that she's spot on. Okay. And I know you've been here before and you've heard us talk about lab work. So that was a great question too by you. But I want you to recognize that in certain instances, sometimes people just think like when they're going through this process, this is the only variable that has to be considered. So like if you're ever in a situation where you suspect like an infection or your doctor says, you know what, we need to get these labs for these reasons, then don't ever be afraid to get the labs. It's just to clarify and add to that clarity, I guess, that Andrew provided is that we want to let the dust settle, if you will. But if it's a necessary, request by your doctor because they're suspecting, some type of infection or God forbid you get in an accident or anything like that, I would never want anybody to be worried to get those labs. Does that make sense? It could be a potential what we call outlier lab, meaning it's really not a true or accurate, as she said, depiction of what's going on the inside. So if at all possible, then it's great to have that period of time because then you'll get a more accurate depiction of it, truly what's going on in the body, what has resolved and or improved, and then also what remains if indeed you feel like you want to continue the process of really working on anything that remains, if anything, like I said. Okay, so hopefully that helps. I just don't want you to be
Yeah.
fearful, or if somebody listening, if you have an infection or, like you're struggling with something that you think is more of a medical condition, what we're doing here is going to help your body heal. And then your doctor in that instance would be identifying if there is any kind of pathological situation going on. So hopefully just to kind of clarify and delineate, what they would be looking for and what we're looking for, we're trying to, watch for improvements and optimization within the body. They're there to look at labs to identify pathology, sickness, and disease. And of course, if labs show up in our lap, we're very capable of identifying those things as well. I just wanted to add to that because I don't ever want somebody to come, to us like concerned to say, should I get it? Should I get it? It's like, yep, if your doctor says, this is a situation where you need it, go ahead and go do that.